Let's talk about stability and dynamization of frame, but we'll take it to a different level. We'll talk about mechanical stimulation of destruction regenerate. Let's add the dimension of complexity with the destruction. And I want to start with something nice, and I ask my new friend, ChatGPT, give me a nice joke to start this real little conversation about the destruction, regenerate, dynamization. And that's what I came with. That's the ChatGPT. So two bones walked in the bar, and one of them says, I'm feeling a bit stiff lately. Could use some loosening up. The other bone replies, well, have you tried axial dynamization? And with this in mind, we'll talk about axial dynamization or destruction regenerate, which I call bone massage with dynamizers. So when we talk about destruction regenerate, even if we finally heal the bone, we still have the problem of delayed consolidation. And it extends time and external fixation. And obviously time and external fixation is not fun. It's soft tissue irritation, the risk of pin irritation and infection. This is joint stiffness. They have it anytime and any time when they frame, but if it's a long time in frame, it's even more. And of course, it's psychological issues. I don't think anyone of us willingly go into external fixator. And therefore, there is different ways to stimulate the destruction regenerate. And of course, there's biology and pharmacologics, but we as an orthopedic surgeon mostly deal with mechanics. So I'll concentrate on this mechanical stimulation. Again, there is different way to mechanically stimulate the regenerate, and we heard some of them. And this is, by the way, the artificial generated image of orthopedic surgeon who does external fixation. So there is invasive ways, okay, lengthening over nails. There is internal fixation after destruction in the frame. There regenerate intentional fracture. And there are some non-invasive ways, which is weight bearing. Weight bearing, this is your mechanical stimulation. This is built-in ability to stimulate your bone. Compression, cyclic loading and destruction, and of course, axial dynamization. Now, and when we talk about axial dynamization, the one thing is absolutely required is weight bearing. Weight bearing on itself is a dynamization protocol, but also adding ability to axial motion of the fragments dynamize the regenerate further. So, but why, when, and how? So we all know about the strain, right? So dynamization works for fracture healing, and I'll show you in a couple minutes a couple proofs like it does. And strain more than 10%, and shear especially, that is what you know, it's bad for the bone. So this, we've done some animal studies with two groups of patients just for the fracture healing, one with stable rods, one with dynamizers, and we use pins on these animals. I'm working in the United States, this American approach. Wire construct is absolutely much better, and we'll talk about it in a minute. But unfortunately, I disagree with Alex, it's not a simple frame. What he showed as a simple frame requires a lot of knowledge of placing and tensioning the wires. So half pins can be a little bit better. So we put the frame, pretty rigid frame, with fins and wires, and the same frame, but you can see a little radiolucent dynamizers in between. And our patients walk with full weight bearing. Again, this is absolutely necessary. And this is the result. And you can see that regenerates are slightly better on the dynamized patients. And then together with Vida, we tried the idea of reverse dynamization on the same kind of group of goats. And you can appreciate not only it's a bigger callus, but it's actually better remodeled callus at the time of removing. But again, all the dynamization was done with axial dynamizers, the devices. And you can see that in reverse dynamization regenerates actually on bone volume, it's more volume than on a normal contralateral extremity. And when we try mechanically break them, they actually not only stronger than other group, they're stronger than other bone. But what about destruction regenerate? So here are some inherent problems. First of all, when we talk about dynamization, this is very ambiguous and not well defined. So it refers to multiple strategies how to do it. So, and because there is no lack of accepted definition What you do, how you dynamize it. Again, I went back to the ChatGPT and asked, what's a destruction regenerate dynamization? It's a gradual translation from a more rigid stabilization to a more flexible or dynamic stabilization during the consolidation, phase or destruction of stereogenesis. Does it tell you anything how you do it? Nope. So there is another broad used term, which I hate, it's micromotion. Because what's micromotion? So what I propose, first of all, forget about micromotion. This is a little bit of the test which I've done. I hope you can see it here. I'm just get the very rigid, typical frame, I'm unloading it. You probably cannot see it easily, but this fragment moves, and it moves 5 millimeters. This is typical fixation of our distal tibia, even with spanning the foot. It's not only moves longitudinally, it has some bending strain into it. And we'll talk about this in a minute. So what I propose, let's talk about axial dynamization. Not simply dynamization. Dynamization is very referred term. What we want to do with axial dynamization, it's a control axial motion at the bone regenerate site with minimum translation and bending strain. Not absence of translation and bending. You can't absolutely ignore it, but minimum. So, and then we can talk about stable fixation. This is external fixation that minimizes shear and bending strain at the bone healing site when some axial motion, not micromotion, some axial motion is allowed to stimulate the regeneration. And of course, rigid fixation, for me, it's a bad thing because fixation is too rigid to evoke the evolutionary developed mechanism to forming the callus and healing faster. So there are some things which called dynamization, but I not consider the dynamization. So gradual frame destabilization, like in this particular case. First of all, if you start dynamizing that regenerate, you already lost it. You're too late. You should have been reacted much faster. This so-called the regenerate cyst when it's absolutely symmetrical. So the only solution here is go back to surgery. So partial frame removal of wires and pins, partial removal of connection rods, gradual untightening of the nuts. It doesn't create axial motion. It creates all kind of motion. It's similar if you untie the struts in hexapods frame. It's just losing it. So frame destabilization can cause pin site irritation because now your wires and pins, they're not fixing as a block, they start moving around. They can use pin loosening or even deformity. So you're not in control. So this is not dynamization. So another problem just mentioned here by Alex, extended use of half pins in modern fixators. This is what happens. This is what your fixed beam loading. When you load the wire, it actually increases the tension, increases the stability the more you load it. And you remove the load, the wire springs back. When you load the pin, this is your cantilever bending. And okay, your pin is not bending like that in fixator because it's not one-point fixation, it's bicortical. But there is the problem. So this is our frames back in Kurgan and some initially in Dallas. It's intrinsically dynamized frame due to tension wires. And I agree with Alex, looks it's modern, or at least, I don't know here, at least modern American frame. How many wires you see on those frames? There's actually one on the left one, but you can barely see. So this is why, if you want to dynamize this frame, to remove this cantilever bending, you have to use some kind of external device which provides this dynamization. Because you cannot really dynamize this frame, and I'll show you in a minute. Of course, the dynamization is not a new idea. This is Giovanni Di Bastiani, the founder of Orthofix company. He first introduced this little, flexible washer which you put on monolateral fixator because he recognized that his monolateral fixators are much more rigid and have cantilever bending compared to Elizara frames. But now we have multiple choices, and again, I'm sorry, I'm working with the company, so here's my disclaimer. This is devices we are using, different dynamization device, spring-loaded dynamizers, flex-place, radial-lucid dynamizer, and the new kit on the block. This is the rapid adjust strut, which is we're using for trauma fixation, but they have built-in dynamization model, so you can loosen the nut and it start dynamizing. And this is our typical frame and our typical protocol. So this is where we use hexapods, multi-axial deformity, which we need to correct. So it's a typical Blount disease, and it's obviously typical Texas size patient. So we applied the hexapod frame, we corrected the deformity, But as soon as we correct the deformity, it's already kind of seen, not symmetrical regenerate, but it's at the end of correction. So immediately switch to dynamizers. And when we switch to dynamizers, absolute requirement for the patient, again, to weight bear, because if they're not weight bear, there is no dynamization. If they're not weight bear, there is no muscle function. There is no muscle function, there is pump in the venous flow, so they swell and they not heal very good. In this case, they heal. And surprisingly, as soon as we put dynamizers on those patients, they feel much better, and each and every one of them tells the frame is lighter. So this is a result of the treatment. And nice alignment. There is another case. This is bilateral multi-level deformities. Was the rickets girl who came to us. We done bi-level correction with the frame on one side. As soon as we corrected it, we put the dynamization units there. And this is here with dynamizers on the frame, healing pretty good. And this is here out of the frame. As soon as we done one leg, we put here another frame. And this is here after finishing the correction. See, she's working pretty fine with the dynamization units, not concerned and not unhappy. And this is your final result. So now axial dynamization is method of choice for all of our patients in frame. We don't do reverse dynamization, and I'll tell you in a minute why. For the destruction regenerate, we need to find out protocol. And each and every patient is happier there, much more comfort and less pain. And we also find shorter rehabilitation time. And let's come to the reason. What's actually dynamizers do? This is our experiments. What we do, we build the typical construct for our proximal fixation, 2 half-pin and a wire. Sorry, we went away for traditional Elizarov fixation points, double ring blockers wires, but this is what majority used. And this is the data loading. So when you load the pin, this is your force load, and this is displacement of the fragment. So you can see the reverse curve, unloading curve, has the plastic deformation on the pin there. So this is why it's not straight. And this is what happens. So this is all wire construct. So for each kilogram of loading force, this is how displacement goes, and it stops somewhere around 4 millimeters. It can't really go anymore with pins unless you exceed 50 kilograms. So this is your pins and wires construct with no dynamizers. You can see it's much more rigid flame, less displacement on the fragment. When you add the metal dynamizer spring, so initially it goes very light, and then it goes to the wall wire construct when it's finished, kind of close, sorry, to the more like a pin construct. So initially it allows you more motion, so it's softer. And when you take our plastic dynamizers, sorry, it's even less rigid frame, especially initially. And let's take a look. I'm a visual person, so what happens actually with those pins? So if you load one pin, this is obviously cantilever bending. But we never use one pin on the frame. At least we combine with the wire, or most often we combine with 2 pins. So that's what happened with 2 pins, right? When you load it, it loads like that, right? Unless you use the rubber pins. So actually what happens, they bend differently. So when you load 2 pins in the fragment, there is forces trying to slide the fragment from the pin one way or another. So that's not only decreases stability, and how many of you have loosened pins when you're removing the frame, but it also creates irritation. So this is why we use dynamizers. And again, this is graphic representation. Sorry, it's not exactly what's happening, but it's close to what I believe is happening there. So when you load the dynamizer, before the pins start bending, they actually move with dynamization units. And this is what happened here. Again, we done this technique and we checked again what happened, how much translation you have on 10 centimeter fragment fixed with different methods of fixation. So if you put 2 half pins in the wire and you apply 50 kilograms, you have 3 millimeters of axial motion, and it moves anteriorly 5 millimeters. We're talking about micromotion. Now, if you fix it with dynamization units, so now you only need 23 kilograms for 3 millimeters, and it only moves 1.7 millimeter up. It still moves up. The construct is not symmetric. You're fixing more anteriorly, so it's still moving there. But it's 3 times less motion anterior bending force on the regenerate one. So this is interesting graph. What we decided to do, we take different construct. Let's take all wire frame, like there, and we see for each millimeter of axial displacement, how much fragment actually moves bending anteriorly. It still does, because we don't fix the bone in the middle of the ring. So your fixation is not symmetrical. Even when you use all the wires, you still have displacement. But let's add some other lines. So this is what happens if you have different frames with pin and wire constructs, depending if 2 wires, 1 pin, or 2 pins and wires. See, for 1 millimeter, you can have up to 2 millimeters translation, or even up to 3 millimeters, depending on the construct. So you now have bending on the fragments together with the force. When you add metal dynamizers, it actually makes it very similar to all-wire construct. And where more elastic plastic dynamizers, they give you less translational forces when the patient loads the frame. And this is loading, right? So hybrid frames with no dynamizers, not good under loading. We actually done the study. We looked for our 12 recent patients with a new dynamization, and we look for their time and fixator and healing index. And obviously, this is not dynamized time and frame on average. And this is the patient with dynamization. So we save on average about 40 days in frame. Again, we're talking about pediatrics, so our patients heal pretty good. And looking about healing index, 66 days per centimeter in non-dynamized matching controls, and 40 days per centimeter in our dynamized group. So that is what we do now. Your bone stimulation, especially bone regeneration stimulation, should be reactive approach. You don't do it when you see bad regenerate. You do it for each and every patient. So what we do, it's weight-bearing destruction technique. So axial dynamization works. You need to have device and proper device and start stimulation of regenerate because it improves interfragmentary motion. So what you don't know is what's the optimal magnitude, how much actually transverse motion can be tolerated, and what's the still best time for the regenerate. So it's more studies to come. So this is our method of choice for all our patients afraid. We start 2-3 weeks after finishing correction. There's more comfort, less pain for the patients, much shorter rehabilitation time. And there's another kit on the blog that's called PI, your personal AI. And I asked it, how we can introduce dynamization in layman words. And this is what came. Axial dynamization is a fancy way of saying bone massage. It doesn't actually involve any massage-like movements. It's just giving you regenerate and gentle nudge to encourage it to heal faster. So with this in mind, even if you're doing or trying to do all wires frame, it's still not absolutely stable construct and not absolutely symmetrical construct. So dynamization, we need more studies, but it works. Thank you.